Hi, everyone. My name is Lindsay Woodington, and I am the lead data manager of the Colorado Health Access Survey. One of our primary focuses of research at CHI is inequities that exist across our different communities in Colorado. However, these communities are diverse, unique, and are often not represented in the data that is currently available in many different data sources. I'm here today to talk about a way that we have tried to address this gap in information using data disaggregation. We use this method to learn more about specific identities that make up the Hispanic or Latino community in Colorado. Now, what is data disaggregation? Data disaggregation is the method of separating larger groups into smaller populations to understand trends or patterns that might have otherwise gone undescribed. That way, health services researchers, for example, can use this information about these subgroups to better understand differences in health outcomes, use of services, health behaviors, or barriers to accessing healthcare. Concepts like culture, identity, race, national origin, and ethnicity are incredibly complex, are intersectional, and influence how someone interacts within our social environments. And how these concepts appear in Colorado are unique to our state. With all of this in mind, we explored one of Colorado's identities, the Hispanic or Latino community. Nearly 1 in 5 people in Colorado identify as Hispanic or Latino. That's over 1 million people in our state. And within that 1 million, there are vastly different communities and cultures that are clumped together within this large group that are often not represented in any data sources. How can we learn more about these unique communities that call Colorado home? CHI used the Colorado Health Access Survey to apply data disaggregation. And we did not do this alone. We engaged with community organizations whose work focuses on serving the Hispanic or Latino community across the state. With their help, CHI was able to understand more about the different communities that exist within the Hispanic or Latino group. These identities that were included on the CHAS were Mexican or Mexican American, Caribbean, Chicano, South American, Central American, Latinx, and another group that allowed people to write in their own answers. These identities include country of origin as well as political or social identities that are important to capture in our state. Now, why might disaggregating our larger communities be important? By including these disaggregated identities on the CHAS, we can then dive deeper into understanding how these groups report on specific data available on the survey. Things like mental health or more about their experiences accessing healthcare in Colorado can help us understand where distinct barriers or important successes might be happening across these specific groups that we might have otherwise not been able to detect. First, let's look at how many people identified with the groups that were captured on the survey. Individuals surveyed were able to choose any number of identities that resonated with them. About 3 in 4 Hispanic or Latino Coloradans identified as Mexican or Mexican American, while another 1 in 4 identified as Chicano. About 1 in 5 Hispanic or Latino Coloradans chose the other option, where they can tell us more about their own identity. This could indicate the need for even more disaggregated groups that we might not have captured here on the survey this year. These data highlight the importance of the CHAS having disaggregated data, as tens of thousands of individuals identify with each of these specific communities. Now, let's look at a specific example of how we can apply these disaggregated data. Poor mental health, especially during and after the COVID-19 pandemic, has been a major focus in public health. Here, we can actually look at the rate of poor mental health for each of the disaggregated identities that we captured on the CHAS. And we can really see how differently these communities are impacted by poor mental health. Those who identified as Latinx, who are also more likely to be younger, had the highest reported poor mental health rate than any of our other identities. Now that we have this information, we can further research why this might be. For example, what other identities such as age, gender, sexuality, or race might intersect with Hispanic or Latino sub-identities to help explain these differences? What might be specific cultural contexts that shape these data? How might some cultures talk about mental health compared to others? Data disaggregation allows analysts and leaders to estimate key differences that can lead to more specific research questions. And this in turn can create funding opportunities, expand programming, and provide services like health navigation to influence changes in these outcomes for individuals. Now, where are we going next with this research? I have been working on this project for over 2 years, and I'm really excited to report that this important work will continue. In our next phase of research, we are going to keep engaging with our community partners who have continually informed and shaped this work. In addition to the CHAS, we will be using 2 other key sources of data available in the state: the Colorado Health Observation Regional Data Service, or the CORDS, as well as the All-Payer Claims Database, to explore behavioral health utilization and diagnoses and how these might differ across the unique communities in our state. That way, we can further explore these data and provide key findings to our community partners to inform outreach efforts, health navigation, and other resources that could impact these differences in behavioral health outcomes. Do you have questions for me? Feel free to reach out if you would like to learn more about this integral work or have thoughts about how you might get involved yourself. Thank you.